The Herbst is a fixed appliance that adjusts the jaw to improve the bite relationship of the upper and lower teeth, correcting bite discrepancies such as an overbite. The Herbst is fixed in the mouth and worn 24 hours per day to help adjust the jaw growth. It is important to take care of your appliance as it remains in your mouth for 9 to 12 months. Brush your teeth and the appliance at least twice a day. It is important to brush all sides of your teeth and gums as well as all surfaces of the appliance. You can use your interdental brushes for harder to reach areas such as the rod and the arms. It may feel strange for the first week while you're getting used to the appliance. You might experience some discomfort from the arms or the rods rubbing on your cheeks. You also may experience some lower jaw muscle aches. If so, you can take pain relief such as Panadol and Nurofen. Cotton rolls can be used to provide relief by resting the cotton roll underneath the lower arms. This will push the cheek away from the rods. You may notice excess saliva flow in your mouth. Don't worry, this is completely normal. Additionally, you may also notice some changes to your swallowing, your speech, and some tenderness in jaw muscles. If you experience any breakages, please call the practice as soon as possible. If you have a breakage or emergency out of business hours, we have provided you an Allen key to help. If your crown becomes loose and is causing you discomfort, you may need to remove the rod. If you are not able to reattach the rod, you can remove it by turning the Allen key anti-clockwise. If your Herbst rod becomes loose, use the Allen key to direct the screw to the attachment on the arm. Turn clockwise to tighten. You need to be careful not to eat any foods that are too hard or sticky as they can loosen the appliance. It is recommended to eat softer foods for the first few days and try to cut your foods into smaller bite-sized pieces to help assist with the chewing.